the very question which is very important and easy question से start करते हैं. You have a 20-year-old woman who complains of double vision, fainting spells, tingling in her left hand and numbness in the right hand. Physical examination shows absence of pulse in the right arm. Lab investigations show increased ESR and thrombocytosis, and there is narrowing of the right subclavian artery. What is the answer over here? Very good. Many of you have not read it properly, but still I would say most of you are answering giant cell arteritis. No, it is not giant cell arteritis. This is, other students were saying Takayasu arteritis. All of you are correct. So let me first teach you Takayasu arteritis. All those who said giant cell arteritis, guys, that I will come to in a while. This was a case of Takayasu arteritis. What does it come under? So we are going to have two questions, table theory ka, then two questions, then table theory ka. That is how we are going. Okay. So please remember, we are dealing with large vessel vasculitis. Large vessel में क्या क्या आता है? सुनो ध्यान से, TNT आता है. TNT means temporal arteritis and Takayasu arteritis. Takayasu arteritis का question था. Takayasu arteritis is known as aortoarteritis. Means क्या effect होता है? The arch of aorta is getting affected. Who will tell me most common vessel affected of the arch of aorta? It is the subclavian artery. I want these answers from all of you. Subclavian artery को ध्यान से देखो radiology में. All these arteries are getting very narrow. I can see they've become very patla. They've become very narrow. As a result of which, what happens, ma'am, if these arteries are getting narrow, the upper limb pulse is going to become very weak. And if the upper limb pulse is very weak, was this written in the question that the examiner gave me? Absence of pulse in her right arm. I'm repeating once again, it is the upper limb pulse which is going to be weak. Is there a yes or no? Lower limb pulse में कोई problem आएगा? No, lower limb pulse is going to be normal क्योंकि subclavian artery का involvement मतलब it is going to be an upper limb problem. Very good. I'm so happy that all of you knew this. This was a case of Takayasu. दूसरा नाम क्या था? या तो Takayasu or aortoarteritis or pulseless disease. Why did all of you mark temporal arteritis in the beginning? I'll show you one question of temporal arteritis. I told you, two questions, one table. So how is temporal arteritis का question going to come? See, you should have mentioned कि temporal artery तो mention होना चाहिए था ना. Number one. Second, they should have shown you some kind of giant cells, right? And giant cells मतलब, that is what you're asking me, Dr. Shyam. Giant cells means that it is also going to have a granuloma, isn't it? So now this is where you had to mark giant cell temporal artery. This is where you had to mark giant cell arteritis. I'll come back to this question, but please note, how does a case of temporal arteritis present? Most common artery I think हमारे सामने है. It is the superficial temporal artery. And for all of those who thought कि मैम पैथो नहीं आता, I don't know patho, I'm not confident. I am feeling that you know more patho than me at this point of time. The way you guys are answering is superb. So temporal artery समझ आया. And temporal artery means what is the most common symptom that the patient will have? It is going to be headache. So headache सबसे common है. See, this is where you will make a mistake. So नहीं गलती करना. Most common headache है, but most specific क्या है? Most specific symptom I've already pointed it out is jaw claudication. Jaw claudication का मतलब jaw pain. Again, medicine भी साथ साथ थोड़ा करते हैं. Okay, what is the most dangerous symptom, guys? What I am very scared of, dangerous symptom is LOV, loss of vision. ये नहीं होने देना. क्यों, कैसे नहीं होने देना? I have to stop this. I'm very worried. Loss of vision नहीं होगा. So what is the treatment in medicine that you give? Do you wait or do you start steroids ASAP? Patient आया, if I have a clinical suspicion, start steroids. Don't wait for any report. Don't wait for the pathologist. Don't wait for any other person. Start steroids. I want to save this. I don't want loss of vision. So definitely temporal समझ में आया. And of course, why did we call it giant cells? Because what I see over here is going to be giant cell arteritis. ठीक है? So ये सब अब वापस जाओ और question में देख लो. If you feel that नहीं मैम question में तो कभी ऐसा लिखा नहीं होता. Look at this. Does this patient have headache? Most common symptom. Does this patient have jaw pain, specific symptom, loss of vision, dangerous symptom. Temporal artery involved है, giant cells दिख रहे हैं, classical case of giant cell arteritis. Last thing you will tell me is going to be the age. I'm so happy all of you. It's giving me so much of confidence कि सबको आता है ये सब. Temporal arteritis is going to occur above 50 years of age and Takayasu arteritis is going to occur below 50. How did we learn it in our rapid revision? कि giant वाले patients में होगा. It's going to occur in old people. It's going to occur in elderly people, right? So more than 50 year वालों में giant cell. All this is done. Very good. We are moving forward to one question which is